so now we're set up, we have everything in position, our patient is supine, we've raised the bed high enough so that we can work comfortably. Our ultrasound is across the patient from us, and our working table is on the same side, and this is going to be on my right side because I'm right hand dominant. The first thing we need to do is take our ChloraPreps and prep the patient, so we'll prep very well, one on each side. And the next thing I'm going to do, like I said, these little packets are considered more sterile than using this big bottle. So I'm not going to touch the patient with the packaging. I'm just going to kind of drop it close to where I need it. And I can do the same thing on the opposite side. Okay. So now, this is open and I wouldn't have touched it. I'll take my sterile gloves and put them on. On. My assistant will hold the probe. And we'll hold this tight. We don't want any air interface between there. The rest of this stuff can be wrinkly, but you just want a nice smooth surface right on the end of the probe. And it's a little bit awkward, but you can get it on there. Now, I'll take my probe, and this hand is not sterile anymore, but when I'm working on this side, I actually want to hold my probe straight on like this rather than at a 90-degree angle, because it's a little more comfortable than bending your wrist. And you want to apply some firm pressure, and we have our 3 layers on the ultrasound machine there. So if you look at the lower portion of the screen, you can see her abdomen with her inhalation and exhalation, her peritoneal space. Next step would be transverse abdominis. Internal oblique is the thickest in the middle. External oblique is the last muscular layer, and then on the very top is subcutaneous tissue. Okay, so now we want to take this. Because the patient's awake, we would want to localize where our needle is inserted. Because I'm demonstrating and not actually performing a block, I'm not going to take this guard off. But one of the techniques to use is to insert the needle 3 or 4 centimeters away from the probe, because you know that you're going to be traversing a lot of tissue with your needle, and you don't want to end up on the opposite side before you get to your plane. So inserting it like that can help you conserve needle. Another tip is, since this is going to be a blunt needle, it'll be very difficult to pierce the skin compared to using a sub-Q heparin syringe or something much sharper. So you can actually pierce through all the layers with that hard pop that you use to get through the skin. So what you can do, since this right glove is still sterile, you can grab pretty close to the syringe, close to the skin on the tip of the needle and just pop right through. And since you're holding only 1 centimeter away from the tip, you can control how deep you go. Another technique is to kind of give it a twist, and it acts like a coring mechanism. So then once you get to your plane, inject your local with your assistant, you can move to the opposite side without repositioning anything. And now we can see our 3 planes there. Give it a little bit of pressure so that I can see everything I want to see. I can see bowel, I can see peritoneum again. And if we scan medially, we start to see rectus abdominis. That's a little too medial for where we want to go. And if we scan a little too lateral, we start to see latissimus and the aponeurosis of our oblique muscles. So we're kind of right on the money right there. And again, I can put my needle right in plane. This is very comfortable for me to reach over like this. And it saves a little bit of time repositioning the probe and everything like that, okay? And it would be the same landmark, same technique as the first side.